Hey everyone, Michael Dudley here. I've been talking to a lot of primary care groups, whether they're health systems, independent groups, ACOs, where the topic of advanced primary care management codes have come up. Some had no idea what they are, some said it's the best kept secret in primary care. So I thought I'd try to bridge that gap. I want to put together a APCM explained video. Let's break it down. So these APCM service codes combine elements of several existing care management and communication technology-based services that you might have already been billing for your patients. Let's get into it. Well, let's start with what is advanced primary care management. I'll give you the highlights and then we'll get into more detail over the next few minutes. But these service codes were released and started to be able to submit claims for January 1, 2025. These, like the title suggests, are new care management codes. Consider them almost as a simplified, more flexible version of chronic care management, CCM, that 99490 code you might be familiar with. You're able to bill them monthly. They're not time-based. There's no time frame restrictions. There's not even really any documentation requirements other than it should be documented in the EHR system. These are G codes, not the CPT codes you're familiar with. You can bill them in the same month as primary care visits, but you cannot bill them in the same month as other care management visits, such as CCM, PCM, and TCM. And then, of course, we'll break down the three levels of these advanced primary care management codes on the next few slides based on the patient's condition. So what are these APCM codes? As I mentioned before, there are three levels, all tied to the patient's condition. We'll start with level 1, the most simple. This is GO556. These are patients with one or fewer chronic conditions. This is actually the first time CMS has released a care management code tied to a patient who may not have any chronic conditions. As you can imagine, it pays the least. It's about $15 per claim submitted. Level 2, GO557. This is patients with two or more chronic conditions. Those familiar with CCM or chronic care management, that 99490 code, nearly identical patients with two or more chronic conditions, but it does pay less, around $50 per claim submitted. Now, last but not least, we have level 3. This is GO558. These are patients with two or more chronic conditions, but are also qualified Medicare beneficiaries. This pays out at $110 per claim submitted. Now, there is still a copay required from the patient for level 1 and level 2, but not for level 3. I'll explain why here in a second. I know what you're thinking. This is a high reimbursement for a QMB. What exactly is a qualified Medicare beneficiary? Well, this is part of the Medicare Savings Program. It's designed to help lower income individuals pay their premiums, deductibles, and coinsurance for Medicare covered services. This is administered at the state level for the Medicaid programs. Patients' monthly income cannot exceed specific amounts to qualify, and they're not required to pay any of these covered services. Now, most people would think of these patients as being their dual eligible patients, but not all dual eligible patients qualify as a QMB. Per CMS, about 15 to 20% of Medicare beneficiaries are QMBs. Oftentimes, this can even be lower for an ACO. You might be saying, hey, Michael, I'm already providing principal care management and chronic care management. How exactly do these APCMs compare to the existing care management codes? Let's look at them side by side. So for the patient eligibility for PCM, patient just has to have one chronic condition. CCM, two or more. As we talked about for level 1 or for the advanced primary care management codes, no chronic condition required. For the initiating visit, a lot of flexibility here. That just has to happen within the last 3 years for advanced primary care management codes compared to within the last 1 year for PCM and CCM. For the billing thresholds, you have to spend 30 minutes for PCM, 20 minutes for CCM. No time requirement for the advanced primary care management codes. For the reimbursement for those 30 minutes for PCM, you get $60 and $46 for the additional 30. For CCM, it's $61 for 20 minutes with the patient and then $46 for the additional 20 minutes. And then we already talked about the different 3 levels for the advanced primary care management codes. So the major takeaway here is if you have patients who have two or more chronic conditions and you would do CCM for them, it might make sense for you to track that time, especially if it's going to be 40 or more minutes, and make sure that you're billing for CCM versus the advanced primary care management codes. But for those patients who only have one or less chronic condition or that are these qualified beneficiaries, it's really good to be able to take advantage of that new billing qualification. So who exactly can provide the APCM services? I have the formal answer there, but ultimately, as long as the patient is tied to a primary care physician, anyone on the care team can provide these services. Really, ultimately, the provider billing needs to be the focal point and then coordinate across specialists or level of provider. I know what you might be thinking. $15 to help any of my Medicare beneficiaries with care management? This sounds too good to be true. What's the catch? Well, if you are not providing chronic care management today or not a part of an ACO, there are some requirements here that you're going to have to put into place. However, if you are providing chronic care management and you're a part of an ACO, you have everything in place today to start billing for APCMs. In fact, CMS has made it even more flexible for you. They have not indicated any type of document requirements other than the fact that it needs to be in your EHR system. And they've also not indicated how they intend to audit the program. Essentially, if you're submitting a claim, you're saying you hit all these requirements. So there you go. Now you know everything you need to about advanced primary care management. You can start reaching out to patients, helping them manage their chronic illness, and submitting those claims today, assuming you hit those requirements. Now you might be wondering yourself, what are other ACOs doing? What are other primary care practices saying about advanced primary care management? How are they setting up their programs? Well, you're in luck. That's all I do. All I do every single day is talk to ACOs and primary care practices, helping them look at risk, helping them look at care management strategies. So I'm the perfect person to ask. In fact, I have 4 quotes here from different ACOs that are evaluating APCM, and I thought each one brought a different perspective. So let's start with ACO 1. They're already doing CCM, chronic care management. When deciding to bill CCM or APCM, we use an if-then billing. If the CCM eligible patient hasn't been seen in the last 13 months, then we utilize APCM. If the CCM eligible patient hasn't had their second chronic condition coded in over a year, then we use APCM. If the CCM patient is a QMB, then use APCM, unless we log more than 60 minutes due to the time period there. A very helpful perspective. Let's listen to ACO 2. They are an MSSP. They say, although we provide care management outreach, we do not submit claims for CCM or APCM because we don't want the copay to hold the patient back and from embracing care, and we don't want the increase in revenue to reduce our shared savings. Now, in the short term, increasing the number of claims could reduce your shared savings, again, on the short term. Long term, we do believe this will lower the total cost of care and a great program long term. However, this is their specific stance on this. As for the copay, this is actually still a big deal. For CCM, the major complaint was the patients would receive that copay and they would say, I'm not getting enough value for this. I'm going to opt out of the program. So that is still relevant here. Solid feedback there for this ACO 2 and MSSP. Let's listen to ACO number 3. They are an ACO REACH. They said, we leverage the Part B cost sharing waiver for CCM and will also now for APCM, as we don't want the cost to be a deterrent for their patient. So one of the things you may not know about ACO REACH is that there is a Part B waiver, cost waiver, that you can actually use so that the patient does not have to have that cost share. Now you have to cover that cost, but it's much better than the patient opting out of a program that's going to help them stay at the hospital. And you still will get to see some of that reimbursement. Now let's listen to ACO number 4. They are an MSSP. They say that the advanced primary care management does not explicitly say conversations have to be over the phone, so we use care coordinators spend designated time with the patient to manage their chronic illness anytime that they're in our office, and then we just add that code. That's one way to do it. Ultimately, these are 4 different perspectives that I thought would be beneficial for you to hear. Now, if you are a primary care practice or a health system and appreciate care management, maybe you're interested in joining an ACO or learning about risk tiering or risk sculpting, I'd be happy to help you out. Reach out to me on LinkedIn or send me an email at michael.dudley@pearlhealth. Thanks again and have a great day.